For analysis, I'm joined from Sydney by Dr. Mary-Louise McLaws, an epidemiologist and advisor to the World Health Organization. Good to have you on the program again. We've seen the most reported cases of coronavirus in just the last 24 hours. What does that indicate to you?
Look, it explains to me that there's a lack of a concerted effort to try to contain this virus across many of the countries, including some of the low and middle income countries that are either struggling or have decided to go with herd immunity. We have Brazil that on one day had as many as 55,000 cases. But it's very difficult to tell whether or not, even though we've had one of the largest numbers, whether or not it's a true number, because there are many countries that are struggling to keep up with their surveillance or don't have very good surveillance or testing in place.
We're seeing more and more countries reopening despite the increasing numbers, more and more people going out, starting to resume their normal lives, as well as people not wearing masks, in many cases refusing to wear a mask, despite all the evidence that we know that does help prevent the spread of coronavirus. Why do you think that is?
Look, it could be a factor of either their governments are confusing them and wanting them to get back to an economic position, and therefore are lifting restrictions fairly early, and therefore the populace think that they're not at risk anymore, or they have failed to understand that every single person can make an enormous difference in their own country and in their own city to try to contain the spread. Now, why they're not wearing masks, some countries are not understanding that WHO has updated their guidelines on mask wearing, where the infection rates are high, or people can't keep their distance. Now, some countries are interpreting the decrease in their cases as not high. For example, the UK. I mean, they have about over 1,000 cases new every day. And in other parts of the world, they would think that that's very high. So some are lifting restrictions, and the populace are not hearing that that may well be an economic approach, but it's not necessarily a good infection control approach without mask use in the public.
We keep hearing talk about a second wave of infections, but when you look at the numbers, it's clear that we're still very well into the first wave. What concerns you about this first wave of infections as we see increasing growth and we get nearer to the fall when we are expecting this second wave to hit?
Look, I'm not sure that there will be necessarily a break between first and second waves in some countries. For example, the US has an unusual pattern, and it looks as if it's a pattern from multiple different approaches, which I believe it is, where the UK is starting to decline, but it still has a large number of cases every day, while Brazil is skyrocketing up every day. And India, of course, is on the way up. So they're the four top ones. And then, of course, there's Russia, of course, where they have about 8,000 cases that they're telling us every day. So there'll be some countries that may have a second wave when they start lifting restrictions, but there'll be others that will just continue to grow. And we're not sure about the true seroprevalence in the community. In other words, the exact rate of infection within the community, and we don't really know how long your antibodies last anyway. So you may catch COVID-19, but you might not be protected for the second wave. And that's why it's so important that everyone does their bit, not only to protect their fellow citizens, but to protect themselves, because you don't want to catch this nasty disease.
Yeah. Okay, we're going to leave it there. Mary-Louise McLaws, thank you.